I'm going live. Okay, one moment. Hello, I'm Dr. Maria Solindro, Integrative Anti-Aging Medicine, practicing in Pasadena, California. Thank you for listening to this channel, as my goal is to improve the community awareness. Today, we have returning physician as my guest speaker, Dr. Cynthia Shelby-Lane. Let me introduce her background a little bit here before we talk about our topic. So Dr. Cynthia is an emergency medicine specialist who has been practicing integrative anti-aging medicine for more than 2 decades in the Great Lakes state of Michigan in Detroit. She has been doing live YouTube as my guest speakers for community awareness of COVID-19 and vaccine update. And since this has been since March 2021. We both are integrative medicine physicians, and we are not immunologists, and we are not infectious disease specialists. We share this with you, what we know from our knowledge and experience and an updated information in medicine. We hope you all benefit from what we do for the local community and the world around us. So we are going to cover pediatrics in specific, although we also update you with the COVID-19 itself. This is the COVID-19 and vaccination in children. Is it safe or dangerous? Okay. So Dr. Cynthia, hello.
Hello, Dr. Maria. How are you? Good to see you again.
Good to see you again. Thank you so much for your time. Every month we just want to pick your brain, so-called, for this information. So now, Dr. Cynthia, the children are going back to school, and some school have started, but some school have not. But we know for sure in September, there are more open schools. And in California, I don't know about your state, we are going to have mask mandate removed on June 15, and all restaurants, theater, everywhere, all business are going to be open, including the gym. Oh, this is kind of like scary. But my first question, is, how many children are infected of COVID-19 up to date in the United States or probably globally? Do you have the data for us?
I have some data, and it's interesting that you said that they're going to lift the mandates for masks, et cetera, for children. And I just left outside of my backyard, and the children are playing. I haven't heard children playing outside. They're having some sort of game. So it's at the school behind my house, and it's like, wow, that's a different sound. Children laughing and playing. So yes, children are important, because you have children, I have children, I have grandchildren. So
my grandchildren.
So up to date, according to the research I've done so far, it looks as if there are about 4,800,631 children who have been infected with COVID-19 as of January of 2020. So that's almost 5 million children who got
globally.
That's United States. United States. Yeah. So I don't know globally. I don't know. You know what? Looking for data is kind of tricky. So I just stuck with what I could get easily, and because the numbers change every day.
Okay.
Globally, there have been, well, in the United States, 33 million people have gotten infected with COVID, adults and children. And the deaths have been 592,776. So that's,
Wow.
But there's a decline, and so we're getting better. The numbers are going down. The hospitalizations are going down. The deaths are going down. The total number of deaths for children, though, I know you're going to ask me that, there's been a total of 582. So that's quite a number. And according to the American Academy of Pediatrics, that's one of the top 10 deaths for children since the pandemic began. So
top 10.
Yeah.
Okay. Now, do we know though if the COVID-19 virus infection in pediatrics or children is the same virus as is in adult globally or US?
It's the same virus, and there's also the problem with the variants because the virus does mutate. And so the variants, there's several variants out, but the one that people were most concerned with initially was the B.1.1.7. And then that was from the UK. And then there was a South African variant. And then there's also a variant from Brazil. And the reason why so the numbers for children are now between the ages of 0 to 24. So that's the age range we're talking about.
24, not 18?
So it's up to 18, but actually when they look at the data, they say up to 24. There's the 18 to 24 group, and then there is the 0 to 17 group. But when they looked at the data, they're seeing that in that age range, that 22% of infections are now in that age range group, that total group. So they're about 1/5 of the people being infected, 1/5 of the total people being infected in the United States. One of the reasons when you ask about variants is because the B.1.1.7 and the one from the South Africa and the one from Brazil, they looked at why is it so dangerous and what's happening with that variant, especially in children. And when they talked about children having undeveloped nasal passages, and therefore the variant is more easily transmissible and may be more dangerous, but more easily transmissible in the nasal passages of children. So you know how children will come home from school and they'll pass things on to their family, because if a school gets an outbreak, all of a sudden you get a note, the kids can't go to school, and everybody in the house gets infected. Well, this is part of the reason is that kids can get it a little bit easier, and they're not vaccinated. So they're the unvaccinated population. So we're going to talk about that shortly, but that's an unvaccinated population. And that's part of the reason why children may be getting more infections, number one, and they're out playing again. Children are out playing, and they have not been allowed to be vaccinated, number one. We're going to talk about that. And they haven't been really tested as much in the beginning. Remember, all adults were being tested. Children weren't tested.
So when you were reading about that, did you just notice this infection happen lately when we start maybe opening partially business, or because we know that the children or young adults are quite immune to this COVID-19? You remember that?
Yes.
Yeah. So what happened?
So part of it is the states have been opening. Part of it is that kids have been playing with each other. So they've probably been asymptomatic and maybe transmitting the virus amongst themselves. Some of the kids are probably doing some sports. Some of the kids have gone back to school. Not many, but not every school is 100% open. So that is part of the reason why they're seeing maybe an uptick in the number of children who have the coronavirus. In addition, the adults got vaccinated. So they're probably not transmitting it back to the children, but the children are amongst themselves and in the community. So that's part of the reason.
Okay, so these numbers are the numbers mostly happened recently then, because I haven't heard about the children and young adult being infected in the early or the beginning, and now suddenly it's millions.
Right. And that happened after, like, what was it, October, November, December, January. So that's when the numbers went down. And now you're seeing more people move around, more states with the vaccination. So the vaccination really started the whole process in January of this year, January 2021.
I see.
And then that's when there was more movement. It depends upon the state. It depends on, like, Florida. I don't know what's happening in California. Michigan is still, I think 70% of the population in California is vaccinated. But in Michigan, we have lower numbers and we had higher incidences. I think that's because people in Michigan would go to Florida and then come back home. So the snowbirds, they call snowbirds because they want to be in the warm climates. Then they come back home. And then all of a sudden, the governor in Michigan allowed people to start going into restaurants. They started opening up restaurants and other venues. That's just been really like 4 weeks ago. And so you're starting to see numbers go up and it's one of those, what do you call it, epidemiological things. How do I watch the numbers? Where do I watch the numbers? Why are they going up? Why are kids getting sick? Are kids more prone to getting infections? The adults aren't getting infected, but the kids are. So it's a movement issue. It's a movement in communities.
Okay. So when you see all those numbers, did they also mention how many are hospitalized? And I know you mentioned the death of the children reported so far from COVID-19. How many percent were hospitalized, or did they stay home and self-isolated?
It looked like there were more than 20,000 hospitalized. 20,000.
20,000. Oh,
yes. Out of 5 million infected, about 20,000 hospitalized, 582 deaths. And yeah, we just keep looking at the numbers.
So remember about this, before the pandemic, we know that cold symptoms were, millions, and versus the COVID-19 symptoms, cold symptoms and COVID-19 symptoms. What, what special symptoms found in the pediatrics? Something about this MSI syndrome, skin heart, MSI, children.
Right. So that's another area of interest when, so let me go back. I looked at the news. I got this from the news, so the media. It said they reported that there were approximately 2,000 cases of the flu reported last year, the 2020 season, versus 38 million that are normally reported. So that's a lower number. So you're looking at a response with people wearing masks, people being socially isolated, and people staying at home. So now people are getting ready to go back and mingle amongst each other. They're probably not going to wash hands the way they ought to, or they're not going to be socially distant, and they're not going to be wearing masks. So now they're looking at what's happening with people. Cold symptoms are starting to crop up again. And people are saying, wow, I hadn't had a cold in over a year. And all of a sudden, even in children as well as adults, I have a headache, I have fever, I have chills, I have a runny nose. Oh, do I have COVID? And so now there's going to be I'm just saying, I can see a trend happening. If you don't know if you have because the symptoms are similar. If the symptoms are similar, and then you go into a workplace or a school or a restaurant, it wasn't the temperature thing that was going on. It's that people recognize in their bodies that they're sick. Now, do you have to get COVID-19 testing for every single cold that comes up? I don't know. There's no answer. Nobody's asking that on the internet. That's what I'm asking. But because the symptoms are very similar. And I can see, because my grandson goes to school, and if somebody's sick, they'll tell them stay home. You don't get snow days, you don't get sick days, you stay at home and watch everybody on Zoom. So the symptoms are similar, and we're going to have to be real particular as we go forward, looking at our kids and saying, do you have a cold? Do you have COVID?
It's going to be very confusing when school is open.
Right, yes. It is.
Well, I hope the parents at home, after watching us for at least, 3-4 months, they are doing the same thing as what they have to improve their own immune system, which is with the vitamin, with supplements such as vitamin C, vitamin D3, also quercetin, zinc, and, probably the treatment that I give to my patient for prophylaxis is ivermectin, but for the pediatrician that are not using that, maybe they can ask them, is the treatment as far as what happened with the adult the same as with the children?
In terms, okay, so
if you go to the hospital,
if you go to the hospital, so the treatment for adults and treatment for children is the same. If you go to the doctor and they say you have COVID-19, go home and quarantine. There's no treatment. Nobody's getting any treatment. Most doctors aren't even telling them what you just said. Get your nutritional basis and foundation of vitamin D, vitamin C, quercetin. Nobody's being told that by their usual primary care doctor or their pediatrician. When you go to the hospital, you do get similar treatment, and that would include probably an antibiotic, something for inflammation, steroids. Children who got, it's a multi-system inflammatory syndrome in children. That's MIS-C, because it's also in adults. And that's a syndrome where they noticed that some children were getting sick, even with the vaccination. So that's coming up too, that they have problems with their ears, their nose, their throat, but their kidneys, but mostly their heart. And they're developing a symptom of diagnosis called myocarditis. So it's very rare, but it does happen. And those children, when hospitalized, have to get, and they have to be concerned about blood clots as well. But those children have to get the steroids and IV immunoglobulins, antibiotics, and it's similar based on age and size and weight, but similar.
So when they get to the hospital, that's what they get. That's what they're given
for their hospital stay. Yes, yes.
I see. So did you read anywhere about this prevention of COVID-19 in pediatrics being exercised similar?
Say that again.
The prevention for COVID-19 in pediatrics group, are they similar to the adult groups?
So this is what I read, and I read it everywhere, whether it's adult or children. Yes. Wash your hands, 6 feet distancing, cover your mouth, stay fully hydrated, eat well, don't eat a bunch of junk food. It's nothing real specific. And so when you talk about integrative medicine and integrative pediatrics, I think we have learned enough about the immune system to know what to tell moms and dads and parents, grandparents, what to do for their children on a nutritional side, on a nutritional supplement side. So the general information is the same all over the world. Wash your hands and stay socially distant. That is not enough to protect your immune system, in my opinion.
Yes, no, I agree with you. They have to exercise similar because the children are now at home and their body might not be able to make the vitamin D3, you know, although you don't have to give vitamin K, but the D3 is very important and vitamin C will help them. And a little zinc, you know, you can do a small reduction in size, but when they get to 15 years and above, look at your grandson, it's bigger than you. So you cannot cut half of the dosage for him.
No, it is interesting when you mention my grandson, because I'll tell him, look, it's time to consider the vaccine for you. It's just time to consider it, okay, because it's available. And so we're doing a lot of research in our own family to figure out what we're going to do with the vaccine for my grandson. I said, would you take vitamin D? Oh, I don't know. Okay, if I put it in a dropper and put it in your water, would you take it? Yeah, I'll do that, Granny. But other than that, so it's hard to get kids to be disciplined to do that. So I think we have a challenge on our hands and try to keep our kids healthy with the, but you mentioned something to me last week. You said all of a sudden, everybody's concerned about their health with COVID. Everybody wants to know about prevention. Before that, we would just be talking. But I don't know, man, that sounds good. They trust you. They don't trust many doctors. I'm telling, oh, vitamin D, vitamin C, must be a quack. No, that's not true. We have the science behind all of that. So I think because of this, because of our immune system is being under attack, people are ready to listen and understand what's going on.
Yes, for children and young adults, I even have a supplement that has everything in one. So it's called Immuno One, because they refuse to take more than, let's say, 2 or 3 each time. So I say, okay, take this one. It has the vitamin C, vitamin D, the zinc, the quercetin, everything is in one. So Immuno. So anyway, let's talk about vaccines. So since you already mentioned it, how many kinds of vaccine is it for children available?
So Pfizer Pharmaceuticals did their studies for vaccines for children in the age 12 to 17 last year, I think in September of 2020, and they just got emergency use authorization, not approval, as of May of 2021. They did a study on approximately 2,200 children, and they divided them into 2 groups, one who got the vaccine, the other who got the placebo. Of the group that got the placebo, they said that 18 of the children came down with COVID-19. And I was concerned because they didn't ever really mention, so I have to go back and read the study again. So they got COVID-19. Why did they get it? Just because they were not immunized, and were the others who didn't get it, were they exposed to COVID-19? So there's some gaps in what I read and what I'm trying to figure out. On the other hand, they couldn't find any real significant side effects related to the vaccine outside of pain at the injection site, fever, tiredness, nothing more than that. So based upon that, they got emergency use authorization from the FDA, and they're now rolling out the vaccine in 12 to 15-year-olds. And that's where we are as of this moment in time. So the vaccine is being rolled out. That's Pfizer Pharmaceuticals. Moderna is also doing studies for 12 to 17-year-olds. So those ages kind of get blended, and they won't know if they will have a vaccine for children until sometime around September. So there are phase 1, 2, and 3 clinical trials completed for Pfizer, and now Moderna is doing their clinical trials. AstraZeneca, Johnson & Johnson have not been, I don't think they're testing, and they haven't been approved. And then they're looking at doing trials for children 6 to 11. So that's because, babies are a certain size and weight, and 6 to 11-year-olds have their own issues. And then you get 12 to 15, and they become more like the 16 to 18-year-olds. And then you got the 24-year-olds, and then you have adults. So they divided them up into all those categories so that they could know, do these kids get the same adult dose, or do they get some sort of pediatric dose? Is there a lesser dose that's still effective, or do we give them the same adult dose? And I don't know the answer to that. I'm not sure the American Academy of Pediatrics is looking at all of that. But they are allowing doctors and pediatricians to give the vaccine in their offices.
So I want to clarify this one. So children from 0 or 1 to 12 are vaccinated or not?
Not yet. No.
Not yet.
No. They're still doing.
No babies, no children under 12 were vaccinated.
Not so. There's no authorization for vaccines for that age group. They are doing clinical studies right now in that age group, both with Pfizer. And Moderna is doing age 12 to 17. So that's where the clinical trials are being.
Volunteers.
Yes, volunteers. And I read one doctors volunteered all of her children. They thought it was pretty important to do that. So, I mean, it's just, I still think at the bottom line, and when we finish this, it's all personal choice, because you and I both know that there are anti-vaxxers, there are people who believe the vaccine, there are people who think the mRNA vaccine came out too early, although it's been out there for over 10 years and used with outbreaks like Ebola, and people are like really still hesitant. They're hesitant for themselves, and they're hesitant for their children. And so those concerns do need to be taken into consideration when you're talking about mandating vaccines for children. That's not happening. It's not happening yet. It's becomes more of a political issue, and I think it gets complicated.
So the approval on the emergency use started at the age of 12 through 16 or 17 for Pfizer.
Yes.
Okay. And the side effects so far, they never reported other than just pain on the side, fever, and the flu symptoms. That's all?
Right. Nothing more than if you got the flu shot. Nothing more. But then, so those were the main side effects. But then there is one condition now, which we talked about, MIS-C, multi-system inflammatory syndrome in children. A few have reported myocarditis, and that's where who gets this? Why do they get it? Why do they get the thrombosis? Why do they get the kidney problems? They don't really know. And so they're looking into, the CDC has put out guidelines. If you have those symptoms, take your child to the hospital, number one, report it to the doctor, report this to the CDC, report it to the health department. So they're looking at the rare number of cases who have developed myocarditis. It's similar to a syndrome called Kawasaki's syndrome, which affects the heart. Like it's almost like an autoimmune disorder. So when I say there's no side effects, those are the reported problems from the vaccine so far in a few number of cases. And so parents should be aware of that.
Okay. So the preparation of the vaccines available are still mRNA.
Yes,
right?
mRNA. That's right. Absolutely.
Okay, well, let's talk about or discuss about the advantage or disadvantage of vaccination. Is it going to change their DNA and is it staying for a lifetime? So there is no booster, or do they need to have booster after their completed 2 shots?
Okay.
Let's talk about that. So I think they all want to know about this. Yeah.
Right. So according to the data, it does not affect the DNA. Number one. Number two, will you need a booster? Nobody knows. They don't know. They're assuming that the coronavirus will be with us for a long time, just like the flu virus, and that you will need a booster at some point in time, adults and children. So that's the assumption right now, and they don't know how long the effects of the vaccine last in your body. So there's an unknown piece to the pie at this point in time. What else did you ask? Just me another question.
What's the advantage or disadvantage? Yeah.
All right. So parents want to know, should my kid get a vaccine? Well, here's what's happening with kids. Kids have been isolated. They've been at home. They're getting cabin fever. Mental illness is going up. Eating disorders are going up. And suicide rates are going up. The vaccine, the promise of the vaccine is the promise, okay, is that now kids can socialize, kids can go to sporting events, the Olympic athletes can participate in the Olympics because we have a vaccinated population. Kids can go to museums, kids can hang out with other kids at parties, and they can do all sorts of kid-like things, like I heard in my backyard today with the kids playing. So that is the advantage, socialization. The disadvantages, we don't necessarily know the long-term effects. And I can say that with honesty that we're looking at mRNA vaccine. Yes, it's been there for over probably 10 years. It is still it's a novel virus. Coronavirus is a novel virus. And the vaccine for coronavirus is also a novel vaccine. So we're going to be looking at this slowly and a lot of research. I'm telling you, even though we're talking about children today, we'll probably be talking about children in September and at Christmas time, because the children are going to be the new breed of what does this virus do? What does the vaccine do? What are the variants doing to our children? How does it affect their health? Is it healthy for them? Do they need a booster? Can you make children who are going back to school take the vaccine? So that's a question.
Can you make the children go back to school and take the vaccine? You mean like if you don't take the vaccine, then you cannot join this like that?
Yeah, can they do that? So for school, they look at public schools in particular, maybe private schools as well. The current vaccination mandate is that measles, mumps, rubella, diphtheria, tetanus, polio, all of those vaccines are approved by the FDA. The vaccine for coronavirus, which is Pfizer, Moderna, they have not their emergency use authorization. The school systems at this point can't really mandate that you have a vaccine that's under emergency use authorization. Pfizer and Moderna are trying to get emergency use authorization taken off so they will be there forever. So we're going to see what's going to happen in September. September is going to be really interesting because some parents are going to say, I'm not going to do this. And they're going to need their doctors to say, can you say for medical reasons or religious reasons that my child does not need the vaccine? Now you bring a doctor in who says, well, I don't really want to get involved. And now you have the school system. So you see, it's a mushroom effect of things that may happen, and we don't really know. I do know that for sports activities and kids who want to play sports, their parents will probably say, oh, come on now. You want to play basketball, you want to play football, you want to play soccer, you want to be in the Olympics, just get the vaccine. So it's going to be one of those kind of situations. It's going to be very complicated in the fall.
This is really it. Okay, so let me clarify first before I make a comment.
Okay.
So you're saying because it's an emergency use, vaccine only approved for emergency use, so you cannot put this COVID vaccine as a mandate but you can only do the one that is approved by FDA, such as polio, DPT, tetanus, and things like that, right?
So that's tradition. That's the
Yes,
traditional way it's
yes,
worked. All right.
mhm,
And so there will be an argument that it's not even approved by the FDA. So how can you mandate it? That's an argument.
yes,
That's an argument on one side. All
yeah.
right. And then the school system come back with their argument, but this is a pandemic and we want the safety of the school. You want your kid to come to this school, you have to get them vaccinated. There's going to be an argument.
So
There,
I can see that that is going to happen. You're right.
yeah.
However, if I'm the principal or I'm the teachers, okay,
Uh-huh.
those children who have been vaccinated, they don't have to worry, right? Because that is what they want. Children to
Presumably.
be
Right.
vaccinated.
Yes. Yes.
Actually, they don't have to separate the kid because the parents that have the children not vaccinated, they are not afraid. They are not
Yeah.
afraid of the children being vaccinated. So
Yeah.
if the parents believe that vaccine is good, they shouldn't be afraid because they should not question the vaccine to
Right.
protect their children from the people, from the other children that are not vaccinated.
Vaccinated. Right.
You see what I mean?
Right. I do. So you could see in the fall when schools are open and everybody's going back and maybe you wear a mask or maybe you don't.
Yeah.
I looked at the data. It says 30% of parents like, yes, I want the vaccine immediately. My kids are getting it right now. And 26% of the parents are like, no, hold on, wait a minute. I need some more
I
evidence.
think it's more than that. I heard it's 60.
Well,
And
I don't know. It depends on
it-
what you read, but it's still not everybody. Everybody's not in the same.
yes,
So when they
it's
all go back to
okay.
right, when they go back to the same school, it's going to be this. Are your kids vaccinated? Can you ask that question? Can parents? Can the school ask that question? I'm wondering. And can parents ask other parents? Did your kid get vaccinated? Why didn't you do it? You know how kids fight. Parents fight when their kids are on a little league team,
Yes.
and now they're going to your kid's not vaccinated.
So for those parents who get what do you call that? Like this argument with those parents who have the children vaccinated, I would
Mhm.
wish they can ask a question. Don't you trust your vaccine? They have to ask. Don't you
Yeah.
trust your vaccine? Why you want to be, arguing with those that are not vaccinated? Just trust your vaccine. And then,
Right.
yeah,
Right.
it.
Yeah. I know. So,
That's a good point that children are going back to school in the fall. In their activities, do you know that there will be a mask mandate? I think you mentioned a little bit about this.
yeah. So it's going to depend. This is evolving. So there's going to be summer school for some people. And in summer schools, at least in Michigan, they're asking the students to wear masks. In the fall, it's going to be presumed, according to President Biden, that there's going to be 70% vaccination by July 4th. There'll be herd immunity. And then they're probably going to allow it to be school system by school system by school system and district. Oh, you don't need to wear a mask. Maybe you should wear a mask. It's going to be state government. It's going to be local government. It's going to be all sorts of governments involved in this. I'm assuming that there will be no mask mandate.
Okay. Yeah. Because,
Yeah.
it's not good for the children to wear masks all day.
all the time, and they're going to and then that's going to be the question: do your kids vaccinated versus non-vaccinated? That I don't think you should separate the kids in the classroom. That's real discrimination. That's
psychologically it's very bad.
Yeah.
So
we're going to have some more issues. I
agree with you. Okay.
So there are forums online from some groups that I've seen that if for college and university, if you don't want your kid vaccinated, you pull this form down and you take it to the school, and the school has to be responsible for anything that happens to them as a result of mandating the vaccine. It's going to get very political. It's going to get very hot. We got children involved now. 17. That's not the right number. Anyway, there's gonna be a lot of children involved in this, and a lot of parents, and a lot of opinions. So I think we're hitting a nail on the head, and we gotta figure out what to do.
Yeah. So. Okay. So that's very good. And can we have a take-home message, please?
So I think we are like 1 year plus into this whole COVID-19, the virus, the vaccine, the mask, the social distancing. And the bottom line is we have a very fragile immune system, and we do have to take care of our health in so many more ways than just a vaccine. We have to protect our immune system every single day. And that does mean, and we'll say it every time, I'll say it every time I'm here, you got to get the right nutrients in, you have to do exercise, you get the right amount of sleep, and you have to really sit down with yourself, your maker, and decide, is the vaccine for me or not? And do your homework, do your research. I mean, I'm getting calls now from the health department. They want to drop off vaccines and have me pass them out. I'm not in that business. I'm not in that business. And I want to encourage people. I think, you know what? I'm so divided on what's going on with right now with the vaccine versus no vaccine, but getting vaccinated has helped us to open up the country, and there have been few side effects, and we're going to learn more about the vaccine, mRNA in particular, and then we'll learn if it's helping, not helping, and the side effects. I think there's so much more to be learned and gained from just keeping these conversations going and keep learning.
Well, thank you so much. And we'll have you back next month, and we'll see what happened after 1 month of this approved emergency use of vaccine. And we will continue to learn more and update you listeners. And thank you so much. Don't forget to give thumbs up for Dr. Cynthia. Yes,
That's right.
I like every month the first week now, because then I get to see you and talk to you more.
That's right.
Yes, thank you so much, Dr. Cynthia Shelby-Lane. And this is Dr. Maria Sulindro. Yes, Dr. Cynthia.
Thank you, Dr. Maria. Thank you. And thank you for your guest. Thank you for coming. This is a fantastic thing you're doing. Love it. Just absolutely love it.
Yes, thank you. And this is Dr. Maria Sulindro, integrative anti-aging medicine, practicing in Pasadena, California. And for those who listen to today's topic, don't forget, just build your immune system. And that is probably the best message that Dr. Cynthia have given. Thank you. Good night.
Bye-bye.
Bye.